All right, hear me out. If you've ever stared at the toilet bowl wondering, is this a UTI or something? You're actually not alone. Hi, everyone. I'm Dr. Jasmine Bonner. I'm a critical care nurse practitioner. And today we're going to talk about urine color, why it matters, what it can actually indicate, and when you're having the UTI symptoms, and when it's actually not a sign of infection. Because urine color gives us a lot of clues, but it's only one piece of the actual puzzle. So let's start off, why does it matter? Urine color actually reflects, number one, and the most important one is hydration status. It also will tell us the concentration of waste products. It can show us the presence of blood, that's the red tinge, or inflammation. Certain medications or supplements can actually adjust the color of it. Color alone does not diagnose an infection or diagnose a disease, but it can really guide what actually might be going on. So if it is clear, pale yellow, this usually means you're well hydrated, urine is diluted, and most importantly, you can still have symptoms of a disease even while you have clear urine. It just shows us some good hydration status, especially in bladder hypersensitivity or interstitial cystitis or pelvic floor dysfunction. So even if symptoms are present but urine is clear, please don't dismiss them. It just really shows us good hydration status. If it's dark yellow or even an amber urine, this often indicates dehydration, so completely opposite. Concentrated urine, and this matters because concentrated urine can really burn. It's super spicy. It irritates the bladder lining and it can worsen urgency, it can worsen frequency, and in many patients, increasing hydration alone can specifically reduce these symptoms. So even if there's no infection present, we really want to make sure we maintain this pale urine color. So cloudy urine, and this one gets a lot of attention. So cloudiness can be caused by white blood cells, can be caused by vaginal discharge, it can be caused by contamination, it can be caused by dehydration, or it can be caused by phosphate crystals. So key point here is that cloudy urine does not automatically mean bacterial UTI. This is why urinalysis and cultures matter more than visual inspection alone. What's always really scary is pink, red, or cola colored urine because it can suggest a lot. Number one, it can be blood in the urine or bladder or urethra irritation. Could be an active infection that's happening. Could be a kidney stone is coming or just happened. Recent exercise, especially strenuous exercise, can happen. Menstrual contamination. And then with a UTI, blood can actually occur due to inflammation of the bladder lining, capillary irritation, and any unexplained or persistent blood really should be evaluated. You need to see someone immediately. Orange or really bright yellow urine often is caused again by dehydration. B complex vitamins can do it. Certain medications like phenazopyridine, so azo. So this color change is often medication related and not worsening of infection. So you usually just want to talk to your doctor which one of these could be causing it. Urine can be green or blue. And why does this happen? It's rare, but it can. Certain medications can do it. Certain dyes used in medical testing can do it. And rare bacterial causes can do it. And if this is unexpected and persists, definitely go see a doctor. Super important. So why urine color can be misleading? Because recurrent UTIs typically have symptoms constantly. And so whether their urine is pale or orange or yellow, it doesn't mean that it's an infection. It can mean an array of things. So if you notice a color changes during flare-up but no infection is present, so there's no infection, there's no bacteria or pathogens, it can be just related to bladder inflammation, can be related to chemical irritation. It can be caused by pelvic floor tension, if there's any type of nervous system sensitization, and that is why treating every color with antibiotics is totally inappropriate and it makes things worse, not better. So what actually matters more than color when evaluating for UTI symptoms? I like to look at symptom patterns. So when does this happen? Usually a journal works great for this. Making sure we get a culture and an analysis so we really understand, or a microscopy to see really what's going on the cellular level. A patient history, because urine color is a signal, it's not a diagnosis. So if you are dealing with urinary symptoms, don't ignore major color changes. If all of a sudden one day it's bright orange or bright red, please contact your provider. And don't panic if it's a yellow pale one. And don't rely on color alone either. So if you're having other symptoms, even if it is pale yellow, we need to make sure you get an accurate diagnosis and not just guesswork. I hope this helps. Many people always ask me about urine color, so I hope this gives some more information about bladder and pelvic health education. Send this to someone who's stuck in, is it a UTI, or someone who just wants to know more about urine color. And remember, your symptoms deserve thoughtful care and not just prescriptions.